today's topic is disorder of the respiratory tract. Okay, in that we will see the disorder or disease condition which is related to the respiratory tract, or we can say a ventilatory system. Okay, so first we will see the disorder of the upper respiratory tract. Okay, so what is upper respiratory tract? Which includes the nasal cavity. Okay, nasal cavity, then the pharynx. Okay, then the larynx. Okay, above the trachea there is a upper respiratory tract. Okay, upper respiratory tract. So we will see first disorder or disease condition which is occur because of the some causative organism. So first one is infectious and inflammatory disorders. In that, first condition that is a common cold. Okay, it is a common disorder, or we can say a common symptom. Okay, so common cold which include, it is also known as a coryza. Okay, it is also known as coryza. It is caused by the rhinovirus. Okay, the causative organism for the common cold, that is the rhinovirus. It is a highly infectious. Okay, it is widely spread. Okay, it is highly infectious. So, which are the symptoms? Symptoms of the common cold, that is runny nose. Okay, runny nose, that is called as a rhinorrhea. Okay, this is the terminology. Runny nose, that is the rhinorrhea. Then sneezing, then sore throat, then slightly fever because of the infection into the nose. So this is the symptoms of the common cold. Now, in the infectious and the inflammatory disorders, second condition that is known as the influenza. Influenza produces far more severe symptom than a cold. Okay, it is like a common cold, but it has more serious or more severe symptoms as compared to common cold. So which are the symptoms? First one is a fever because of infection, then aching muscles, okay, muscle ache or body pain, then headache, okay, then dry and persistent cough, then shortness of breath, and runny or stuffy nose, sore throat, and pain into the eye. So these are the symptoms of influenza. Now, in the infectious and inflammatory disorders of the upper respiratory tract, third condition that is known as a sinusitis. Okay, what is sinusitis? As you know, okay, what is the meaning of the itis? Itis means infection or inflammation. Inflammation. So, an infection of the paranasal sinus. Okay, what is sinusitis? Sinusitis means what? Infection of the sinus. Okay, which are the sinus? That is a paranasal sinus. So, infection or inflammation of the paranasal sinus, that is sinusitis, which is caused by spread of the microorganism from the nose and the pharynx to the mucous membrane lining the paranasal sinus. Okay, it causes infection from the nose and the pharynx. Then symptoms. Which are the symptoms of the sinusitis? So first one is runny nose. Okay, then stuffy nose. Okay, nose blocking like feeling, that is a stuffy nose. Then facial pain or pressure. Okay, in here these are the paranasal sinus. So at the site of the sinus there will be slightly pain or feel like a pressure, headache, then mucus dripping down the throat, or we can say post nasal drip. Okay, sore throat, cough, and bad breath. So these are the common symptoms which is associated to sinusitis. Okay, if there are repeated attack or if recovery is not complete, then the infection may become chronic. So this is a common condition, but sometimes it occurs recurrently. Okay, persistent. infections which may cause a chronic infection. Now the infectious and inflammatory disorders in that tonsillitis. Okay, what is tonsillitis? Tonsil plus itis. Okay, tonsil plus itis means what? An inflammation of the tonsils. Okay, so itis means infection or inflammation. Okay, infection or inflammation. So it is the inflammation of the tonsils. So which is caused by the viruses and staphylococcus pyogenes. This is a causative organism. Which are the symptoms of the tonsillitis? So in the tonsillitis, red and swollen tonsils, white or yellow coating or patches on the tonsils. You can see in the figure, this is the tonsils, okay? Tonsils, okay? These both are. So infection or inflammation of the tonsils, you can see in the figure how it occurs or how it looks. So red and swollen tonsil, okay? See, it is in red color. Red tonsils, swollen tonsils, okay, swollen. So white or yellow coating or patches on the tonsils, you can see this is the white patches over the tonsils. Sore throat, then difficult or painful swallowing because of the inflammation of the tonsils. Fever because of the infection. Enlarged and tender glands or lymph nodes in the neck. Okay, in the neck area, here there is a lymph node, okay, here as well as here. So at this side, the inflammation of the lymph node in the neck area. Then scratchy, muffled and throaty voice because of the inflammation into the larynx or pharynx. So there will be scratchy and muffled and the throaty voice of a person. Then bad breath. Okay, so these are the common symptoms of the tonsillitis. Now in the infectious and the inflammatory disorders, the pharyngitis, laryngitis and the tracheitis. Okay, you can see first the pharynx, larynx and trachea. Okay, three parts, three organs of the respiratory tract. So they become infected because of the secondary infection or other respiratory tract infection. Okay, so pharynx, larynx and trachea, it has infection or inflammation because of some infection or because of the secondary infection. Okay, like a common cold, like a tonsillitis, okay, like a influenza. Because of that, there will be infection or inflammation to the pharynx, to the larynx and to the trachea. That is known as a pharyngitis, laryngitis and the tracheitis. Showing that the airway is obstructed. Okay, the airway is obstructed by marked swelling around the larynx and the epiglottis. Okay, which is accompanied by the wheeze and the breathlessness. What is breathlessness? There is a difficulty in the breathing. So what is known as a difficulty in breathing? That is known as a dyspnea. Okay, see, this is the dyspnea means what? There is a difficulty in breathing. Okay, that is known as a dyspnea. Okay, so these type of symptom can be seen into the infection of the pharynx, larynx and the trachea. Now in the infectious and inflammatory disorder, this condition is known as a diphtheria. Okay, what is diphtheria? So it is a bacterial infection of the pharynx. Okay, in the pharynx there is a bacterial infection that is known as a diphtheria. So which is caused by a specific organism that is known as a Corynebacterium diphtheria. Okay, Corynebacterium diphtheria, which is a causative organism for the diphtheria. So which may extend to the nasopharynx through the trachea, means from nasopharynx to trachea. Okay, it has infection. It has bacterial infection of the Corynebacterium diphtheria. So The sign and symptom usually begins 2 to 5 days after a person become infected. Okay, so the first symptom will develop after the infection of the 2 to 5 days. Okay, so we can say incubation period of the this bacteria, that is 2 to 5 days. Okay, what is incubation period? Okay, the organism enter in our body and they develop first symptom into the body. So that period is known as a incubation period. So which symptoms of the diphtheria? It includes a thick gray membrane covering your throat and the tonsil. You can see here there is a gray membrane, a sore throat and the hoarseness of the voice because of the infection into the throat area, the swollen glands, or we can say enlarged lymph node into the neck area. Okay, here there is a lymph node, there will be swollen, okay, or inflamed. The difficulty in breathing as well as the rapid breathing. Okay, so what is difficulty in breathing? That is known as a dyspnea. Nasal discharge, there is some discharge or liquid that comes from the nose. Then the fever and the chills because of the infections. So these are the common symptoms of the diphtheria. Now immunization is widespread, diphtheria is rare. Nowadays the diphtheria is very rare or common. It is a very rare condition, not common condition. Okay, why? Because immunization or vaccination is available in today's era. Okay, the vaccine is DPT. Okay, diphtheria, pertussis and tetanus. Okay, DPT. This vaccine is given into the children at the age of the 6 week, 10 week and 14 week after the birth. So this is about the diphtheria. Now into the infectious and the inflammatory disorders. Hay fever, or we can say allergic rhinitis. Okay, what is hay fever? What is allergic rhinitis? So this condition means atopic or immediate hypersensitivity developed due to foreign proteins, or we can say antigens like pollen, like mites from the pillow, feathers, okay, animal danders. So these are the example of the foreign particles, or we can say dust. Okay, so foreign particle or foreign pathogens enter into the nose and they cause allergic reaction. So that is known as a hay fever or allergic rhinitis. So acute inflammation of the nasal mucosa and the conjunctiva. Okay, in that these type of symptoms are seen: acute inflammation of the nasal mucosa and the conjunctiva. Which are the symptoms? Which are the prominent symptoms? First one is rhinorrhea. What is rhinorrhea? That is a runny nose. Okay, so excessive watery exudate from the nose. Okay, excessive watery exudate from the nose, that is a rhinorrhea. Then redness of the eyes, okay, because of infection is spread into the conjunctiva. So that occurs in that eye. So redness of the eye, excessive secretion of the tears because of the infection into the eye. Okay, so excessive secretion of the tears or watery exudate. So these are the hay fever, or we can say allergic rhinitis. Now we will see the obstructive lung disorders. Okay, in that first one is a bronchitis. Okay, obstructive lung disorder. So in that first one is a bronchitis. Bronchitis means what? Okay, infection or inflammation of the bronchi. Okay, bronchi plus itis means infection or inflammation of the bronchi. Okay, so there is a two type of bronchitis: acute bronchitis, chronic bronchitis. Okay, so acute bronchitis, it is a secondary bacterial infection of the bronchi. Okay, bacterial infection of the bronchi, that is secondary infection. Why? Because of the infection is spreaded into the upper respiratory tract. This infection will be transmitted into the bronchi. So that is known as a secondary infection. Okay, because of common cold, okay, because of the influenza. So that is preceded by the common cold or we can say influenza or any other infection. So it may also complicate measles and the whooping cough into the children. So because into the children there is infection is spreaded into the bronchi. Secondary condition may occur measles as well as the whooping cough into the children. Now we will see the chronic bronchitis. Okay, acute bronchitis, chronic bronchitis. So in chronic bronchitis, the chronic bronchitis is defined clinically when an individual has or had cough with sputum more than 3 months in 2 successive years. Okay, what is chronic bronchitis? So individual has a cough with sputum. Okay, there will be presence of the sputum for 3 months in 2 successive years. Okay, within 2 years. So that is a chronic bronchitis. The changes occurring into the bronchi which include increased size and number of the mucus gland. Okay, the size and number of the mucus gland will be increased. So more mucus will be secreted into the bronchi. Edema and other inflammatory changes into the wall of the bronchi. See, this is the wall of the bronchi. You can see this is the normal and see this is the bronchitis. You can see in the figure bronchitis there will be more inflammation. Okay, inflammation. So more inflammation into the wall of the bronchi. Reduction in the number and the function of the ciliated cell. Okay, here there is a ciliated cells. So there will be reduction in the number of the ciliated cells. Fibrosis of the airways. Okay, there will be thickening of the wall. So fibrosis of the airway. Breathlessness or we can say difficulty in breathing, that is known as a dyspnea. So these are the common symptoms or changes into the wall of the bronchi of the bronchitis patient. Okay, so what is bronchitis? There is the infection or inflammation of the bronchi. Now into the obstructive lung disorders. Second condition, that is known as a emphysema. Okay, what is emphysema? The air sacs in the lungs or we can say alveoli are damaged and the inner wall of the air sacs become weakened and the rupture. Okay, so what is emphysema? The alveolar wall become damaged or it become weak and might be rupture. So that is known as a emphysema. Okay, you can see in the figure this is a healthy alveoli and see this is the unhealthy or we can say emphysema patient's alveoli. Okay, you can see this is the rupture of the alveoli or we can say weakened wall of the alveoli. The long-term inflammatory condition or irritation of the airway like in the more smoking or we can say a chain smokers or in the coal miners. Okay, they are working in the factory of or we can say coal miners. Okay, so factory workers, smokers, they have the more chances to get emphysema. It is a long-term inflammatory condition. Okay, so these conditions lead to progressive destruction of the supporting elastic tissue in the lung and the lung progressively expand. That is known as a barrel chest. Okay, the lungs will be expand. Okay, as compared to normal condition, as compared to normal shape, the lungs will be expand and chest looks like a barrel chest. Okay, now which are the symptoms of the emphysema? The frequent coughing and wheezing, a cough that produces a lot of mucus, shortness of breath, especially with the physical activity. Okay, when hard or physical activity doing, so at that time breathlessness is there or difficulty of breath is there. Whistling or squeaky sound when breathing, and tightness in the chest. Okay, so there will be less amount of the oxygen exchanging into the alveoli. So these condition, and because of emphysema, this type of the symptom can be seen. So what is emphysema? There is a damage of the alveolar wall. Now in the obstructive lung disorder, next condition that is known as asthma. So what is asthma? It is a common long-term inflammatory condition. Okay, it is a long-term inflammatory condition, or we can say because of the chronic respiratory tract infection, this type of infection can be occur. So long-term inflammatory disease of the airway of the lungs. Okay, that is the disease of the airway of the lungs. The mucous membrane and the muscle layers of the bronchi become thickened and the mucous glands become enlarged, reducing airflow into the lower respiratory tract. Okay, so into the lower respiratory tract, there will be the bronchi become a very thick, mucous gland become very enlarged, and they reduce the airflow into the lungs, into the alveoli. During the asthmatic attack, the spasmodic contraction of the bronchial muscle, that is known as a bronchospasm. Okay, the spasm of the bronchial muscle, that is known as a bronchial spasm or bronchospasm, which constrict the airway. There is excessive secretion of the thick sticky mucus, which further narrow the airway. Okay, at the time of the asthmatic attack, you can see figure. See, this is the normal bronchial tube. Okay, see, this is the abnormal, or we can say asthmatic patient's bronchial tube. See, here there is a infection or inflammation, or there is a thickening of the wall or swelling of the wall, tighten smooth muscle. Okay, here there is a relaxed smooth muscle. Okay, so because of there is a poor diameter, okay, there is a low diameter into the bronchi, so that's why they cause the shortness of breath or asthmatic attack in that bronchospasm and more mucus secretion. So they narrow the airway, and there will be, because of that, there will be a shortness of breath. In severe acute attack, the bronchi may be obstructed by the mucus plug because of the more mucus secretion, leading to the acute respiratory failure, hypoxia. What is hypoxia? Less oxygen and possibly death. Okay, so this is the chronic condition. Because of the asthmatic attack, patient can be die. Now into the obstructive lung disorder, next condition, that is bronchiectasis. Okay, bronchiectasis. So what is bronchiectasis? The permanent damage. Okay, there is a permanent damage, abnormal dilatation and thickening of the bronchi and the bronchioles. Okay, there is a permanently damaged or abnormal dilatation and thickening of the bronchi and the bronchioles. That is known as a bronchiectasis. You can see in the figure, see, this is the bronchiectasis patient's figure, as well as see, this is the healthy airway. Okay, so in that there is a mucus plug or as well as the dilated airway, and we can say thickening of the bronchi or the bronchioles. So which are the causes for the bronchiectasis? There is pneumonia, pertussis, tuberculosis. This type of the disorders can cause the bronchiectasis, or we can say permanent dilatation of the bronchi. Chronic bacterial infections into the lower respiratory tract, history of the childhood bronchiolitis and bronchopneumonia, cystic fibrosis or bronchial tumor. Is there any tumor? Is there any fibrosis during the childhood? Okay, during the childhood there is pneumonia, there is bronchiolitis. So this condition can cause the secondary infection like a permanent damage or permanent dilatation into the airways. The bronchi become obstructed by the mucus pus and inflammatory exudate. Okay, the airway will be obstructed because of the more mucus secretion or plugging of the mucus, inflammation, or we can say pus secretion. The lower lobe of the lung is usually affected. Generally, the lower lobe is affected in both lung. Okay, the suppuration is common. Okay, so this is a common symptoms of the bronchiectasis. So what is bronchiectasis? There is a permanent dilatation, permanent damage or thickening of the bronchi as well as the bronchioles. Now we will see the restrictive disorders in that. First one is a pneumoconiosis. Okay, pneumoconiosis. So this is the group of the interstitial lung disease which is caused by the inhalation of the certain dust and the lungs tissue reaction to the dust. Okay, these condition or these type of disease occur because of the inhalation of the particular dust as well as there is the allergic reaction of the dust. So principal cause is related to the workplace exposure and environmental exposure. Okay, because of the working area, industrial area, okay, or because of the environment exposure, is there any changes into the climate that can cause the infection? Okay, that is known as a pneumoconiosis. So coil workers pneumoconiosis. Okay, so particles of the coil dust that load mainly into the upper low or we can say 2/3 part of the lungs and ingested by the macrophage inside the alveoli. Okay, inside the alveoli in that there will be macrophages are there. They kill the and pathogens. They are inhaling into the lungs. Okay, so coil dust can be caused as a infection. They are mostly lodged into the upper 2/3 of the lungs. Okay, into the upper 2/3 of the lungs. Macrophages are unable to digest inorganic particles. Okay, sometimes these macrophages are unable to digest. Okay, but their activation leads to an inflammatory response that can cause the fibrosis into the lungs. Okay, sometimes macrophages are failed to give the reaction. Okay, and there will be a fibrosis can be seen into the lungs. So this is the pneumoconiosis. In that pneumoconiosis, another disorder that is the silicosis. Okay, so which is caused by the long term exposure to the dust which contain a silicon compound. Okay, it occurs because of the more time exposure to the dust which contain more silicon. So the inflammatory reaction can be triggered when the macrophages die because of the significant fibrosis, while macrophages are die because of the recurrent infection or recurrent fibrosis into the lungs. So macrophages will be die and they are not performing it, they are not kill the bacteria or virus, they are, or we can say dust. Okay, or we can say foreign particle, they are entering into the lungs, so they can cause the infection. So gradual destruction of the lung tissue. Okay, there will be gradual destruction of the lung tissue which lead the progressive reduction into the pulmonary function. Okay, they can cause the gradual reduction into the pulmonary function. Okay, they are not performing proper function, normal function. Pulmonary hypertension will be there and right-sided heart failure can be occur because of the silicosis. So what is silicosis? That is long-term exposure of the dust which contain more silicon. You can see in the figure, see this is the silica dust that can be deposited into the alveoli. Now into the pneumoconiosis. asbestosis. Okay, so which is generally caused by the inhaling asbestos fibers. Okay, that is caused by the asbestos fibers. Usually develop after 10 to 20 years exposure. Okay, that is occur after a long term exposure to the asbestos. Okay, generally 10 to 20 years. So but sometimes after 2 years it can be occur. Asbestos miners and workers, they are the victims of this disease. Okay, they are working into the asbestos miners as well as the, or we can say they are the workers. The lung tissue is progressively destroyed with the development of the dyspnea. Or dyspnea, what is dyspnea? There is the difficulty in the breathing. Chronic hypoxia means what? Decrease the oxygen. Pulmonary hypertension and right-sided cardiac failure, that can be leads to death. So this is the asbestosis. You can see in the figure. See, this is the asbestosis microfibers. They are deposited into the lungs. Now we will see the lung infections. Okay. So which are the lung infection? In that, first one is a pneumonia. Okay. So pneumonia, it is an inflammatory condition of the lungs that affect the primarily small air sacs, that is known as the alveoli. Okay. The alveoli filled with the fluids or the pus, and that making the difficult to breathe. Okay, into the pneumonia, the alveoli are filled with the fluid. Okay, which may be a water or which may be a pus. Okay, so that is known as a pneumonia. So which are the causative organism of the pneumonia? So commonest pathogens, that is bacterium Streptococcus pneumonia, or others in that the Staphylococcus aureus and Haemophilus influenza. Okay, these are the common infection, or we can say common pathogens or pathogens, they cause the pneumonia. Okay, most common there is a it is a bacterial infection, so it is a bacterium Streptococcus pneumonia. Now we will see the symptoms of the pneumonia. So which are the symptoms of the pneumonia? Cough, which may produce the greenish, yellowish or bloody mucus. Okay, into the mucus, into the sputum, there will be blood. Okay, it might be greenish or yellowish in color. Fever because of the infections, sweating and shaking, chills, shortness of the breath. Okay, there is a breathing difficulty, rapid and shallow breathing. Okay, sharp or stabbing chest pain. Okay, stabbing or sharp chest pain that get worsen while breathing deeply or coughing. Okay, while we are doing deep breathing, okay, or we are coughing, at that time chest pain can be occur. Loss of appetite, low energy and the fatigue. Okay, this is the general or common symptom. So these are the symptom of the pneumonia. Okay, so what is pneumonia? You can see this is the normal alveoli. See, this is the fluid. Okay, fluid or pus is collected into the alveoli, that is known as a pneumonia. Now into the lung infections, lung abscess. Okay, what is lung abscess? A type of the liquefactive necrosis of the lung tissue. Okay, what is lung abscess? There is necrosis of the lung tissue, formation of cavities more than 2 cm, containing necrotic debris or fluid which is caused by the microbial infections. So what is lung abscess? You can see in the figure, there is necrosis. See, this is the necrosis, and see, this is a cavity. Okay, cavity. Okay, this is a cavity into the lung. Okay, formation of cavity into the lung that is more than 2 cm, and necrosis of the lung tissue. Okay. So this is a localized suppuration and necrosis within the lung substance caused by the aspiration, which can occur during the anesthesia, during the sedation or unconsciousness from the injury. At the time of the unconsciousness, sedation as well as the anesthesia, there will be some product or something that can be aspirated into the lungs. They can cause a lung abscess. Okay, so what is lung abscess? There will be necrosis of the lung tissue as well as the formation of cavity that is more than 2 centimeter. Now into the lung infections. Next disease condition, that is tuberculosis. So what is tuberculosis? So it is caused by the main one organism, that is the Mycobacterium tuberculosis. Okay, it is caused by the Mycobacterium tuberculosis. It is spreaded by either by the droplet infection, okay, from the individual with the active tuberculosis, or in the dust which is contaminated or infected by the tuberculosis organism or infected sputum. So it can be spread by the droplet infection, okay, by the infection caused by the person or which has the infected sputum. Now we will see the symptoms. Which are the symptoms of the tuberculosis? So coughing for 3 or more weeks, coughing of bloody or mucus secretion, there will be more, chest pain or pain while breathing or coughing, unintentional weight loss, there will be fatigue and infection because of the infection, fever because of the infection, night sweat and chills. Okay, these are the common features. Okay, so more than 3 weeks there will be cough or there will be blood or mucus into the cough. It is the key feature of the tuberculosis. Okay, you can see it can be infected by the Mycobacterium tuberculosis as well as by the droplet infection. You can see in the figure, this is the droplet infection from one person to another person while coughing, while sneezing. Okay, so that is a droplet infection. Now we will see the lung tumors. Okay, so it can be benign or it can be malignant. Okay, an abnormal rate of the cell division or cell death in the lung tissue or into the airways that can lead to the lungs. Okay, what is tumor? There will be abnormal cell division or there is a cell death, so that is known as a tumors. Okay, so lung tumors are found into the lung tissues. It may be malignant or it may be benign. Okay, so malignant tumor is known as a lung cancer or lung carcinoma. Okay, into the malignant tumor. The vast majority, up to the 90% of the cases, occur into the smokers who are chain smokers. In that, these condition can be occur. So those who are inhale the other people's smoke, that is known as a passive smokers. Into the passive smokers, that can be occur. Why? Because passive smokers are also a victim of the smoking. Now the lung collapse. So what is lung collapse? You can see in the figure there is a collapse of the lung into this cavity. Okay, see, this is the normal lung, the size is normal. Here the size is reduced, or we can say collapse. So when air enters into the pleural space, the area between the lungs and the chest wall, If it is total collapse, it is known as a pneumothorax. Okay, what is lung collapse? Collapse, there will be a lung is collapsed, or we can say it there is a total collapse. Okay, total collapse. So that is known as a pneumothorax. If only part of the lung is affected, that is known as a atelectasis. Okay, if one part is not affected, so that is known as a atelectasis. So there are four main causes of this condition. Okay, sometimes there will be collapse into the collapse of the lungs. Okay, sometimes the lobes is only collapse. So this is the condition, that is a lung collapse. In that, four main causes. There is obstruction of airway. Okay, that time collapse of the lungs. Then second one is a impaired surfactant function. Okay, the pressure collapse. Okay, there will be pressure over the lungs. Then fourth one, that is alveolar hypoventilation. Okay, there will be alveoli will be damaged, and hypoventilation of the alveoli, that also cause the lung collapse. Okay, so these are the four condition are there that can cause the lung collapse. So this is the end of the topic. Okay, today we have seen the disorder of the lungs. Okay, and we have completed the anatomy and physiology of the respiratory tract. Okay, respiratory tract organs. Okay, so this is the end of the session. So thank you.